Things you should know about gouty arthritis. In the last week video, I mentioned about the signs and symptoms of gouty arthritis and how to differentiate between regular joint pain and gout. But most of you want to know more about gout, including the risk factors, how to treat it, and do's and don'ts in gout. So, in this video, I will mention about these facts you should know about gout. So be sure to watch until the end. But first, what is gout? Gout is a type of arthritis caused by uric acid crystals accumulating between joints in the feet, hands, and larger joints. Inflammation of joint tissue triggers sensitive nerve endings, resulting in severe pain. Uric acid is a waste product produced by the body, primarily from proteins called purines. The kidneys excrete uric acid in urine, but if the kidneys cannot handle the load, they may build up in the body. Gout mainly affects the big toe, but they can also affect knee and elbow joints as well. Gout is one of the oldest disorders known to human. Some famous victims of gout include Alexander the Great, Isaac Newton, and Benjamin Franklin. Who can get gout? Almost everyone can get gout. When their body produces more uric acid than their kidneys can handle. However, it is more prevalent in men, particularly between 30 to 60 years of age. It is also hereditary, which means if your family members have gout, you are more likely to have gout than the general population. These are non-modifiable risk factors of gout, which means you cannot control them. There are modifiable risk factors of gout as well. Binge drinking of alcohol, especially beer, is the main risk factor for gouty arthritis. A diet high in purines, compounds found in certain foods like red meat, organ meats, and seafoods, can raise your uric acid levels, putting you at risk for gout. When your body breaks down purines, it produces uric acid, which can crystallize in the joints and cause gout. Sugary drinks can also increase your risk. Your body's ability to process uric acid is another critical factor. If your kidneys have trouble eliminating uric acid, your uric acid levels can rise, leading to gout. Other causes or precipitating factors of gout include starvation, dehydration, acute illness, and certain drugs, particularly diuretics. It is associated with obesity and hypertension as well. What will happen if you leave it untreated? Gout is a curable condition, but if it is left untreated, high levels of uric acid in the blood can lead to the formation of kidney stones. These stones are composed of uric acid crystals and can cause severe pain, urinary tract infections, and even kidney damage. Repeated gout attacks can cause damage to the affected joints. The buildup of uric acid crystals and the resulting inflammation can erode cartilage and damage bone. This damage can lead to deformities and loss of function in the affected joints, making movement painful and difficult. There's evidence suggesting that people with gout may have a higher risk of developing cardiovascular diseases, such as heart attacks and strokes. Tophi and damaged joints are susceptible to infections. If tophi become inflamed or break down, they can become infected, leading to additional complications such as cellulitis or septic arthritis. Dealing with chronic pain and disability from gout can take a toll on mental health. Many people with chronic gout experience stress, anxiety, and depression due to the ongoing pain and lifestyle limitations. Let's see some treatment of gouty arthritis. Bed rest is important for the first 1 to 2 days. Applying a hot compress or ice to the affected joint may provide relief. Place a bed cradle or similar object under the bedclothes to keep the weight off the feet. Your doctor may give you some painkillers, but the dose and type of painkiller will be adjusted by your doctor, depending on the severity of the symptoms and other underlying medical conditions. But I will not mention the names here, because the one you need to take will depend on your specific condition. To treat gout, simply follow the do's and don'ts, as it may occur only once. But if gout persists, tablets may need to be taken for life to prevent further acute attacks. Let's see some do's and don'ts if you have gouty arthritis. Let's start with what you should do. Restrict intake of food high in purines, especially organ meats, red meats, and seafood. Reduce your intake of alcohol, especially beer and red wine. Reduce or cease intake of sugary, fizzy soft drinks. Eat a normal, well-balanced diet. Drink plenty of water, at least 2 liters a day. Maintain a normal weight, but avoid crash diets. Wear comfortable shoes. Get regular exercise. What about the don't? Don't take your worries to bed. Don't exercise too strenuously. Don't overexpose yourself to cold. Don't drink excessive amounts of alcohol. Don't drink fizzy, sugary soft drinks. Dealing with gouty arthritis can be frustrating. The pain is excruciating, and you do not know when the pain will occur. The unpredictability of gout attacks, where pain can flare up suddenly, often causes anxiety about when the next episode will strike. But if you can change your lifestyle and avoid the risk factors and follow the dose and don'ts strictly, you can reduce the chance of having recurring attacks. Please share this video with your loved ones who might have gout. In the next video, I will talk about foods you should eat and avoid in gouty arthritis. So be sure to subscribe to the channel. If you haven't watched the previous video about the early signs showing you may have gout, check this video.